When you hear about those little dogs like dachshunds having back problems.
Right.
Well, today we're going on a deep dive into a spinal condition that affects, well, a wider range of breeds and has some surprising twists. It's called thoracolumbar hydrated nucleus pulposus extrusion.
Yeah.
Or TLHNPE for short.
It is a mouthful, isn't it?
It is a mouthful.
But what's fascinating is that it's distinct from the more common type of disc herniation we see in dogs.
So TLHNPE is like the cool new kid on the block, shaking things up in the world of canine neurology.
Exactly, yeah. And we're just starting to understand what makes it tick.
Our deep dive today is all about untangling the mysteries of TLHNPE.
Right.
We'll be looking at how it differs from the usual suspects and what this means for diagnosis and treatment.
So our main source today is a recent case control study from the Veterinary Journal.
Okay.
They did a deep dive of their own, comparing TLHNPE to the more common thoracolumbar intervertebral disc extrusion, or TLIVDE.
All right, so we've got our detective hats on. We're ready to get into the nitty-gritty. But first, let's set the scene.
Right.
What exactly is TLHNPE?
So imagine those little cushions between the vertebrae in your dog's spine, the intervertebral discs.
Right.
Now in TLHNPE, the center of the disc, the nucleus pulposus, ruptures and pushes out.
Okay.
But here's the catch. The material that's extruded is hydrated, meaning it's still that fresh, gel-like substance.
So unlike the dried out, crumbly stuff we usually see in disc herniations, this is like a burst water balloon in the spinal canal.
That's a great way to visualize it.
Okay.
And this is what sets it apart from TLIVDE.
Okay.
In TLIVDE, the extruded material is typically more degenerated. Think of it as more like dried up Play-Doh.
Interesting. So we've got these two different flavors of disc herniation, but how do we tell them apart in the real world? Let's start with the dogs themselves. Who's more likely to get TLHNPE?
That's where things get intriguing.
Okay.
Remember how we associate IVDD with those long, low-riding breeds like dachshunds?
Right.
Well, TLHNPE isn't as picky.
It's an equal opportunity offender.
Pretty much. While it can affect chondrodystrophic breeds, meaning those with abnormally short legs and long bodies.
Right.
The study found TLHNPE also occurs in non-chondrodystrophic breeds.
So breed alone isn't enough to rule it out. What about age?
Age is a big one.
Okay.
The study found that dogs with TLHNPE tended to be significantly older than those with TLIVDE.
So if you're seeing a senior dog with back problems, TLHNPE should definitely be on your radar.
Absolutely.
Okay.
And it's not just who gets it, it's how it happens.
Right.
The clinical presentation is often quite dramatic.
So we're not talking about your typical gradual onset of back pain.
Not usually.
All right.
Imagine this. Your dog is running around, jumps off the couch, and suddenly yelps in pain.
Okay.
That could be a classic TLHNPE scenario.
So it's like something suddenly goes pop in the back.
Exactly. Often there's a clear history of trauma or vigorous exercise right before the symptoms hit.
Wow, that's quite different from the slow progressive decline we often see with TLIVDE. But there's another difference that surprised me.
Oh, tell me more.
We'd think that with all that hydrated material bursting into the spinal canal, TLHNPE would cause more spinal cord compression than TLIVDE.
Right. That's what I thought too, but surprisingly, the study found the opposite.
Wait, hold on. Less compression.
Less compression.
That's not what I expected at all. Can you explain that further?
That is the burning question.
Okay.
And to understand why it's so perplexing, we need to dive into the MRI findings, which we'll do in part 2. So this study wasn't just looking at any old back problems.
Right.
They were very careful about making sure they were comparing, apples to apples when looking at TLHNPE versus TLIVD.
So meaning they had specific criteria for diagnosing each condition right.
Exactly.
Especially since TLHNPE is a relatively new concept.
Yeah, they dug through medical records from 2 referral hospitals in the UK, going back over a decade. And for a dog to be included in the study, they had to have, pretty clear-cut evidence.
So no wishy-washy diagnoses?
Nope, no way.
Okay.
For both TLHNPE and TLIVDE, the dog had to have signs of spinal cord dysfunction in the thoracolumbar area.
Right.
Basically, problems with their back legs.
Okay.
And the diagnosis had to be confirmed with an MRI.
So an MRI would give them that detailed picture of the spinal cord and the discs.
Right. But they didn't stop there. For the TL-HNPE group, they specifically looked for those unique MRI features we talked about earlier, especially the signal characteristics of that hydrated nucleus pulposus.
So they were looking for that bright signal on certain MRI sequences, indicating that fresh gel-like material.
Exactly. And in some cases, they had surgical confirmation, too.
Wow.
They could actually see the hydrated material during surgery.
Talk about a smoking gun.
Right.
So they were really rigorous about making sure they had true TL-HNPE cases.
Absolutely. And for the TL-IVDE group, they used similar criteria, but looked for MRI features consistent with more degenerated disc material.
Gotcha.
They were aiming for a clean comparison.
Makes sense. They wanted to isolate the variables and really see what set these two conditions apart.
Now, here's where it gets interesting. They also looked at the dog's history, whether there was any trauma or intense exercise before the symptoms started.
Right.
And this is where the story really starts to unfold.
Because that sudden onset we talked about earlier, that dramatic yelp moment, was much more common with TL-HNPE.
You got it. And the MRI findings added another layer to the story. We've already touched on the less compression mystery.
Right.
But there's more.
Well, I'm all ears. Lay it on me. What else did the MRIs reveal?
Well, remember how we said TL-HNPE seems to have a preference for that specific spot in the thoracolumbar region?
Yeah, right above the L2 vertebra.
Exactly.
Like it has a favorite hangout spot.
Exactly. And the MRIs confirmed that over 90% of TL-HNPE cases were located there. Meanwhile, TL-IVDE was more scattered throughout the thoracolumbar spine.
So location is another clue that we're dealing with something different. It's like TL-HNPE has its own unique signature.
And then there's the question of lateralization.
Okay.
Remember, that's when the herniated material gets pushed off to one side of the spinal canal.
Right. So which bad boy was more likely to play that game?
Well, TL-IVDE was the clear winner in that department.
Okay.
Lateralization was significantly more common with TL-IVDE than with TL-HNPE.
So TL-HNPE tends to stay more centered.
Yes.
Interesting. It's like it's making a statement, I hear and I'm not moving.
Exactly. Now, are you ready for the most surprising MRI finding of all?
Bring it on. I'm on the edge of my seat.
Oh, okay. Remember how we talked about how TL-HNPE involves that fresh, hydrated nucleus pulposus?
Right.
Well, the MRI showed that in almost 40% of the TL-HNPE cases, the affected discs showed no signs of degeneration whatsoever.
Whoa. So it really was like a sudden rupture of a perfectly healthy disc.
Mm-hmm.
No warning signs, no slow decline, just bam.
That's what the data suggests.
Wow.
And that's what makes TL-HNPE so fascinating and potentially so tricky to predict.
Because if those discs aren't showing signs of wear and tear, how do we know which dogs are at risk? That's the million-dollar question, isn't it?
That's the crux of the matter.
Okay.
And it highlights the need for more research. We're just starting to scratch the surface of TL-HNPE.
So we've established that TL-HNPE has its own unique fingerprint, so to speak.
Right.
Both in how it presents and what it looks like on MRI.
Yes.
But let's get back to that less compression conundrum.
Right.
How can something that looks so dramatic on MRI cause less spinal cord compression? I need answers.
Let's unpack those MRI findings even further. In part 3, they hold the key to understanding this perplexing aspect of TL-HNPE.
Okay, so let's get back to that mind-boggling MRI finding.
Right.
TL-HNPE causing less spinal cord compression than TL-AVE.
Right.
It just seems counterintuitive.
Yeah, it is. It's one of the most intriguing aspects of this condition.
Okay.
And the MRI details help us kind of piece together this puzzle.
So walk me through it. What are we seeing on those scans that might explain this?
Well, first, let's revisit the location.
Okay.
We know that TL-HNPE loves that spot just above the L2 vertebra.
Right.
What's interesting is that this area tends to have a bit more space around the spinal cord compared to other areas of the thoracolumbar spine.
So even though you have this sudden burst of hydrated material,
yeah,
there's a little more wiggle room in that area.
Exactly that. That extra space might give the spinal cord a bit of a buffer.
Okay.
Reducing the direct pressure from the herniated material.
That makes sense. It's like having a little bit of breathing room.
Now, remember how we talked about lateralization?
Right.
Or the lack thereof with TL-HNPE?
Right, because with TL-HNPE, the herniated material tends to stay more centered.
Right. And when the material is centered, it might distribute the pressure more evenly across the spinal cord rather than concentrating it on one side.
So instead of a sharp focused jab, it's more like a gentle squeeze.
That's a good way to think about it.
Okay.
Now, here's where things get really interesting. Let's talk about the nature of that hydrated material itself.
That fresh gel-like nucleus pulposus.
Exactly. It's possible that this hydrated material is more easily dispersed within the spinal canal.
Okay.
Unlike the more degenerated drier material in TL-IVDE, it might not be as rigid or dense.
So it might be able to flow and spread out a bit more rather than creating a hard, immovable mass.
Precisely. And this could explain why we see less spinal cord compression on MRI, even though the herniation itself looks, dramatic.
So the difference between spilling a glass of water versus dropping a brick, both make a mess.
Right.
But the impact is very different.
That's a great analogy, and this difference in impact might also explain why some dogs with TL-HNPE seem to recover well with conservative management, meaning no surgery.
Right. So even though it sounds scary, TL-HNPE might actually have a better prognosis than TL-IVDE in some cases.
That's what the research seems to suggest. Of course, more studies are needed to confirm this, but it's a hopeful sign.
It is. Now let's talk about those signal characteristics on MRI. The study mentioned that the herniated material in TL-HNPE has a specific look.
Right. It typically appears hyper-intense or brighter on T2-weighted and gradient echo sequences.
Okay.
These are ways of looking at the spine with an MRI that highlight different things, kind of like adjusting the contrast on a photo.
So by tweaking the settings on the MRI, we can see that the hydrated material lights up like a beacon.
Exactly. And this helps to differentiate it from the more heterogeneous or hypointense signal often seen with TL-IVDE,
Okay.
which might look, darker or more mottled.
So it's another tool in the diagnostic toolbox.
Right.
By looking at the location, the shape, and the signal of the herniation, veterinarians can get a clearer picture of what they're dealing with.
Absolutely.
Yeah.
And that accurate diagnosis is crucial for guiding treatment decisions and managing owner expectations.
It's all about giving those furry patients the best possible care.
Couldn't have said it better myself.
Well, I think we've done a stellar job of dissecting TL-HNPE.
Yeah.
We've explored its unique characteristics, its surprising twists, and what it all means for our canine companions.
It's been a fascinating journey.
It has.
And I'm sure we'll be learning even more about this condition in the years to come.
From Vet Neuro Jar, keep those minds inspired, hearts light, and tails wagging.